Good morning, everyone, wherever you are. Welcome to another episode of. It is indeed my pleasure to welcome you to this episode, very interesting episode, Navigating Elder Care, Why Specialization Matters. Welcome, welcome. If you're not an elder, it's okay, because someday you're going to be an elder and you may find this very interesting topic. This program is sponsored today by the African Women Mobilization Commission. And if this is your first time of tuning in, I am your host, Dr. Wonyo Hosimiri, and I'm the president of the African Women Mobilization Commission, a nonprofit organization that's headquartered here in the United States with philanthropic work all over the world, particularly in Nigeria. It is my absolute pleasure to welcome you today to today's episode. Choosing a primary care provider who specializes in elder care. This is very, very important. Many of us don't take that seriously, but it is very beneficial to make sure that you are being seen, attended to by the right person. But before I do all of that, I just want to introduce you to the African Women Mobilization Commission. For those of you who don't know, I'll do so by taking you to our website and introducing you, and hopefully direct you to the website so that you can see who we are and what we do. I'm very excited about what we do because we actually work to help people in the community. Now, the African Women Mobilization Commission is based in here. Most of our programs are done here in the United States, but we also have programs in Nigeria. I would like to introduce you to the website address so that you can go and find out a lot of what we do. We're particularly excited about some of the things that we're doing to help to raise funds for this organization. And one of those items is the, let's see, we are doing Drive for Change, which is a sweepstakes program. And if you go to our website, you see it. It is quite exciting. You get an opportunity to support a wonderful program, and at the same time, you get the opportunity to go drive away with a G-Wagon, Mercedes AMG G63. I just want to take a moment and play this video for you. So it talks about what the program is about.
Hey, you could win this. This is the Drive Change Sweepstakes. Hey, this 2026 Mercedes AMG G63. But it's not just about the car. It's about making a real impact.
All proceeds support the work of the African Women Mobilization Commission, helping empower women and communities around the world. So you could drive away this AMG G63 and help drive real change. Enter the Drive Change Sweepstakes today.
Yes, indeed, enter the sweepstakes today. Not only are you able to possibly drive away with that wonderful vehicle, but you will be helping so much. Our organization is focused on mobilizing women. You know, anywhere that women come together and do work, it's the best answer to any challenges, because women, when we come together, you know how we are. We make things happen. So we mobilize women so that they can do the work, not just for themselves, but for the needs of this community. And we also are engaged in philanthropy. We take care of many children and women in camps, IDPS camps, internally displaced people's camps. And if you don't know what that is, it's where people unfortunately run to when they are destabilized by terrorism, violence. And so we got about 4 camps that we help to sponsor. We feed them, we help send the children to school. And also we teach the women in the camp how to do certain things so that they can raise money for themselves. So they're not just dependent on people helping them. They learn some skills that they can use to help themselves. So we're very excited about doing that. Then the other thing that we're involved in is advocacy. We advocate for girls. Girls in some of these countries are very, very much traumatized by just being girls, because some of the things they need to make being a girl easy is most of the time missing. Personal hygiene items. We provide young girls with that items, and we go to schools where we encourage the girls to stay in school. Now, some of what they experience is the inability to stay in school. When they start their cycles, they don't have the necessary items that they need to help themselves. So we provide them with sanitary napkins. And again, one of the exciting things is that we hold these conferences where we encourage them to stay in school, because when you empower a woman, you empower a nation. So by empowering these girls, we're actually empowering the nation. The other thing that we feel that is very, very important is culture. It's important that people know their culture. Particularly these young children, they need to know the importance of their culture as the basis for their survival. And that's the foundation that gives them the mirror into who they are. So it's important for them to celebrate it and promote it to the best of their ability. So we have cultural events that help them do just that. Last but not least, we are engaged in training. We believe that training is one of the things that a lot of the women need. We have been so successful providing 500, think about that, 500 IT scholarships for young women, and some girls and some boys have gotten some men have gotten opportunities to take advantage of that. So we're very, very excited about what OMSI. So we want to ask you to visit our website, www.omsiglobal.org. And I will have at some point, I'm going to make sure that I have that information. As a matter of fact, here we are. That's our website right there, omsiglobal.org. You visit us and learn about us and support us. The other thing that is exciting is if you go to our website, you will see where you have an opportunity to shop with us. Sometimes individuals have difficulty donating to nonprofits, but what we've done is helping by shopping is a program that we're using. It's on our website. So if you go there, you'll see where you can actually support us by buying items. Everyday item that you buy, I don't care what it is, I don't care what store. There are 250 stores that support our program. That if you shop at any one of those, they support our nonprofit. So that is how you can certainly help. You can follow us on social media, the Ndumodu Show on YouTube, or Ndumodu TV on YouTube. And also, if you want to write us, the Ndumodu Show at gmail.com. So let's get started with the program today. Oh, before I do that, let me not forget this. This is very, very important. We have a program coming up very soon on the 17th, I believe it is the Business Consortium Initiative. We are bringing businesses together, and the whole objective is that we all come together, pool our resources together so that we can get the necessary resources to do the work that each one of us does. It's like a wraparound program where all of us have programs that this community can use, but sometimes getting funding as an individual organization makes it difficult. So we come together, and as a team, as a group, then we're able to access resources together. And obviously, as far as Kwanzaa is concerned, that's a principle of Kwanzaa, which is cooperative economics. So the African women Mobilization Commission is going to be hosting business consortium initiative. And if you're a small business and you want to be a part of this consortium, contact us at the Dumodu Show at gmail.org. At gmail.com. I'll get the information from that email, anything that has to do with OMSI and the program that we're having. So again, this program is sponsored by OMSI, and we're so proud to be partnering with OMSI to do this wonderful, wonderful program. It's very informative. And if you have not subscribed to the Dumodu Show, I ask you to do so. Again, is the Dumodu Show or Dumodu TV on YouTube. Please, we need your support so that we can continue to bring you information that's very, very important and necessary that you should know. So there you have it. Now, let us start discussion about why we're here today. I'm an elder, and it's a badge of honor for me. I am proud to be an elder. And all of us someday, we're all going to be elders, and it's important that we are proud of being. But, as we get older, some of our needs change. And when our needs change, we must be very, very careful who we're putting in charge of our well-being, because not everybody is specialized in the needs of elders. You want somebody, and I want to thank all those doctors out there who really, really do care about elders and do the best they can to support the elders. But there are so many others who are not specialized in the needs of the elders, and sometimes our needs are ignored. I use myself for an example. I oftentimes go to some of these appointments with trepidation, because the individuals that I'm seeing are not necessarily, or at least the individuals I was seeing, were not necessarily specialized in elder care. So often they don't have deeper understanding of the age-related conditions. And so they give you medications that's probably not the best for you, and not take into consideration how those medications work and how those medications actually make your condition worse if you have a condition. So it's important to have someone who is tailored for older adults. Now, I'm not talking to you as a doctor. I'm not. But I am a person who takes advantage of medical services. And I just know that what I've seen, and I've shared with a lot of individuals who say the same thing, that it's difficult to navigate medical care at the hands of individuals who are not specialized in elder care. So for the most part, you get general attention. You get the attention that will be given to general individuals, as opposed to you as an elder. So it becomes imperative for you to fight for your own welfare. You have to be the person, do your own research, find the best, because there are geriatric physicians out here, and that's what they do. That's what they do. I'm not here to put down any other physicians. I'm just letting it be known that I am well aware that there are those who are better suited for the needs of the elders. I want to give you a case example of elder care. There's a lady who's 78 years old. Her name is Margaret, and she has mild dementia, hypertension, and early stage of osteoarthritis, right? Now, that's a lot of stuff she's got. Okay, and she's on medication, lisinopril, donepezil, acetaminophen. All of those medications may not necessarily interact properly, but she has been seeing a physician who really did not know much about elder care, and so she ended up, being treated as just a regular patient, much to her detriment. But nonetheless, a little bit more about her. She lives alone and has been struggling with daily activities due to her mild dementia and physical discomfort from osteoarthritis, right? Her family is concerned about her well-being and decided to engage a specialized elder care provider this time, as opposed to what she was getting. And then one of the complaints, and I have the same complaints. You know, you go to these doctors, some of them, I mean, again, there are some really awesome ones out there. So let's not get it twisted. I'm not here say advocating that, you know, good doctors are not out there. There are some very good doctors. But if you're an elder, you may want to consider seeking this specialized knowledge, right? Because what do they do? One of the things that I personally see is I notice that um, it sometimes it may take you weeks or even months to get an appointment, right? And you've got all these challenges that you want to discuss, right, with your physician. And then once you see them, some of them, not all of them, but the ones that I was seeing and I had to move away from them, you know, maybe you're seen for maybe 10 minutes and the doctor has his pad in his hand and is, I see. Okay, here's a medication that might work. Wait a minute. Why are we jumping into medication right away? Why are we not going into more details about what my needs, what some of my concerns are? You know, it seemed to me at that time that it was always, you know, okay, all right, here's the medication. So you're being pumped with medications that sometimes is detrimental for your well-being because not only are they counterproductive, they cause problems, and then you're taking other medications that, you know, that don't interact very well. And I think that for some of these doctors, um, because you're an elder, it almost seems like it's irrelevant whether you're okay or not. Hear me, hear me. This is my observation. That may not be true with you, but that has been my observation. And that was the observation of the family of Margaret. They noticed that they take her to the office and takes but a few minutes and they're done and they give her medication, you know, and then she's miserable after using the medication. As a matter of fact, I had some medication myself that was issued to me and I had to call the doctor say, I feel horrible. You know, I've never felt this bad in my life. Everything was hurting, all the joints, you name it. It was medical interaction, you know, maybe, you know, and if the doctors had taken the time to evaluate what the ramifications will be with some for the medications they uh, prescribe, then some elders will feel a whole lot better. You're already feeling sluggish to some degree, and then you put on some medication that just makes matters worse. So that's why it's very, very important that you don't depend on just the physician. You have to do your own homework. You have to do your own research. You have to call your insurance provider and see if they have any recommendations as to who's better suited to take care of you as an elder. Okay, so as I was talking about Margaret, that was had, you know, she didn't get assessment for personalized care plan. The appointments were quick. Let's go. Take these medications. She got worse and worse, and the family noticed it, and they decided that they needed to find somebody who is strictly uh, professional for elder care. Okay, so because that's what they do, they give you full assessment, and you receive the personalized care plan that you need. Now let's be clear: doctors are sometimes terribly overwhelmed. So they may not give you, not because they don't care, but because of them, some of them being overwhelmed, and your care or your challenges may be more than regular people. But they just have so much, they have so many clients, and they have just so much time to deal with. So it's important for you to make sure that you're going to the right person. This is what they do. They create a personalized care plan that includes medication management. There's nothing I resent more than to to call the office of a physician and say, I'm not feeling well about this medication, right? And they tell you, okay, get off that. Here's this other one. It doesn't solve the problem all the medication does is just mask the problem. So if I say that this is giving me a problem, you should ask me to come and see you, but they don't have the time. So some of them don't have the time, and then you have to wait a few more months to come and see them. Yes, I mean, sometimes it takes a whole month too before you can see a particular doctor. I've had a doctor that I couldn't see for 6 months because his time, because of his schedule was very, very tight, so I couldn't see him. But then when I called, because of the challenges I was having with some medication, they put me on another. And I said, I'm not going to get on that. You haven't seen me. You have to see me, do some exam, run some tests or something to make sure that medication is going to do what it's supposed to do. So for some of you, it may be best to not just pop these medications because it was given to you. You may want to really read up on that medication and see what effect it will have on your body, because sometimes it does have terrible, terrible effects on your body, right? So it's your responsibility. You cannot blame anybody for what you allow them to do to you, quite frankly. That's just the God's honest truth. We trust doctors so much that we are willing to give our lives to them. If they say this is what we need to do, boom, that's fine with us. Let's do it. But just remember that it's your life, and you've got to be very careful what you accept. Okay, so sometimes a good geriatric doctor will incorporate physical therapy exercises that are tailored to you, to your whatever the challenges are. This is what happened to Margaret. They tailored her exercise to her osteoarthritis, and her cognitive stimulation activities were given to her to support her memory. I mean, it was just, she just started feeling better. And even the medication management, they started monitoring her medication a whole lot, and they will call her more frequently than she used to. Sometimes her pressure will be high, and they'll check on her and she'll report it's been very, very high, but she didn't hear anything from the doctors. Now what does she do? Does she keep taking the medication or what? That, and some of you know what I'm talking about, because I've experienced that. Your blood pressure is kind of high and you report it, and you don't get a call back for maybe a while. So it's important that, instead of getting mad at the physician, that you say, okay, this is not working for me. I have to find somebody who's going to do better for me, who's going to work better for me. And they're out there. They're out there. So instead of us sitting back and being mad at the physician for not doing what you think they should be doing, find the one that's tailored for you. You can't have a geriatric physician treating a teenager. Obviously, that's not going to work. Do you understand? That's a totally different situation there. So it's very, very important that we find somebody who's going to monitor the side effects, the interactions of your medication, the side effects that will go over, and for her, for Margaret, she's on donepezil, which have side effects that impact her cognitive function. So why would a physician continue that impacts her cognitive function? When you have challenges with your body, some people have heart conditions, some people have kidney issues, liver issues, etc., etc. Some of these medications aggravate those conditions you have. So it's very, very important that you make sure that you ask what the side effects might be. It doesn't make sense to try to cure something when the medication that you're given will kill you. So if the cure doesn't kill you, then you're good. So it's imperative to make sure. I've gotten to the point myself that I am looking, or I'm taking this, I'm taking that. What is that for? How's that working for me? When you get older, little things start to creep up that you don't like, but that's nature. That's the way things are. Doesn't always have to be there. if you're lucky that as you're getting older and you don't have any challenges, bless your heart. But there are many people who don't, who are not so lucky for whatever the reasons are, maybe because of poor diet or lack of exercise, or there are so many things that can cause the body to start degenerating. So there are certain things you can do without pills. You can change your diet, you can start exercising, you can do a whole lot more. But then if you're on these pills and your physician feels that it's mandatory that you be on these pills, then you need to find out for sure how they interact with other pills you're on and how they impact your body functions, your organs, and all of that. Because these medications are not all very good for your organs. I'm sure you know that. That's nothing new. You know, most people know that it's not good for you. So you want to make sure it is that's prescribed for you. Just find out how, or if you don't know, make sure you ask your physician. How does, instead of just accepting it. Now, I stand accused. I've had situations when the physician say, "Oh, take this." I say, "Well, you know, he's a physician. He knows better, you know, than I do. So sure, why not?" But then you start experiencing difficulties by taking that medication. It is at that point that you don't wait around for the physician to tell you. It is that time that you have to call. You have to make your, call the physician or do your research and find out. Maybe there's something different out there that you should know, and ask the physician to share that with you. You know, don't just accept it just because it's a physician. You know, my daughter had worked in a laboratory, and she told me that a lot of the doctors depend on the lab scientists to even give them a diagnosis. So not all doctors are very, very familiar with everything, you know, because they're human. Number one, you know, the brain can only absorb so much, and you can know so much, you know. So it's not something against doctors, of course not. Many of them are very, very efficient, but they don't all know everything. So at some point, you're going to have to be an advocate for your own well-being, you know. So know what affects the condition that you have in a negative way. Well, if you do your research, you'll find some of these medications are really awful. They're really awful and not good for you. You know, they interact poorly with your body. So it's very, very important that you know that. And for Margaret, you know, and her family, the new doctor, you know, specialized in elder care. All right, shared with them the importance of adherence to her medication schedule. All right, ensuring she takes her lisinopril to manage her hypertension effectively. And that's the other thing. When the doctor prescribes it if it's supposed to be within 24 hours difference, you know, you just don't choose to take it. Oh my goodness, well, I'll take it whenever, you know, whenever I can. If you're supposed to take it at 7 a.m., take it at 7 a.m. If it says 8 p.m., take it at 8 p.m. If it says 4 p.m., take it at 4 p.m. Take it when the doctor says to take it. Now, the doctor may say, take in once per day. Doesn't necessarily have to be 7 a.m., but you can set that. You can set the time and stick to it. If the doctor does not specify that you must take it at 7 a.m. or 8 a.m., if it says taken daily, well, if you pick a time that you want to take it, that's most convenient for you to take it, then you must adhere to that time for it to be effective. You can't just take it whenever you want to, you see. So you have to be sure that you yourself, you're doing what is necessary for your own healing. Because quite frankly, they can tell you what to do, and if you're not following it, then, you know, you're really hurting yourself. But if they're giving you something, you're concerned about it, have the courage to ask questions or do your research. You know, my husband always told me, you know, if you go to see the doctor right now, make sure that you know exactly what you're asking. Don't expect them to know, because they don't. And I know that. I've seen that. And I'm sure you have as well. Doctor, and and you didn't write down what you wanted to ask until you leave the doctor's office, and oh my God, oh, I forgot to ask this, I needed to ask this, but it's too late. You have to, you know, write them in your patient forum, you know. But it's always important to be prepared when you go, you know. So a geriatric a physician may focus on preventative care as opposed to just monitoring medication. Now, there are some doctors that I've had, that's all they do is monitor my medication. They don't tell me anything about preventative care. You know, I had some good ones who did, but I do have one now that is really, really good. And you know, they talk about the preventative care, you know, and they talk more to me. This particular physician talks more to me about preventative care as opposed to focusing on pills. If this pill didn't work, oh, let's try this pill. If this one didn't work last time, how many pills have you had? You know, and I said, oh no, I don't take that one anymore. I don't take this one, you know. But okay, let's try another one. Nothing about preventive care. Nothing about how do we get off these pills. You don't need to stay on these pills if you don't have to. If you have to, you have to. But if you don't have to, preventative care may keep you off these pills. So you need to ask the physician. If they're not telling you, you ask, what else can I do from the natural perspective that will work better for me than these medications? Do you know? You would hope that they know. So recognizing the risk of, if you're an elder, whoever it is that you're seeing, you know, one of the questions important that you ask is, what are some of the risks of falling? You know, because sometimes people say, oh, somebody fell and they never recovered. And soon after that, not too long after that, you know, they pass away. Why is that the case? So ask your physician, what is the risk of falls? In my case, certainly there's risk of falls in elders, but in my case, based on your evaluation of me, what are the risks besides me tripping? You know, what's the bone density? You know, could I just buckle and fall? What are the risk factors for that? Because that is so important. And some actually will conduct, for those who are responsible for elder care, they will conduct a home safety evaluation, you know, and recommend modifications, you know, in your home that will help you. Listen, people, we should not be ashamed or embarrassed about being elders. It is part of life. You go through your childhood, you go through your adolescence, teenagehood, adulthood. Now you're in the last phase, elderhood. And that's just the thing. You can't hide it. And if you don't talk about it, if you don't do something about it, you will suffer for it. So if you have a good physician who cares about, who understands about elder care, they may even conduct a home safety evaluation and recommend modifications. If you know, if you need, if your staircase does, if you live in a home that has a stairwell, and you don't have anything to grab, no handlebars and anything like that, you know, they may install it. They may recommend installing grab bars, you know, in the bathrooms or whatever it is that may be a tripping hazard in your home. This is what they do. That's why it's important to find a specialist who's not just focused on what pills they'll give you, you know, that will just, for the most part, just, you know, muddle the waters or just mask the problem but not fix it, you know. And they focus on checkups, frequent checkups. I like that, you know, frequent checkups and screenings, that emphasize the importance of preventative care. You know, they tell you about vaccinations that you may need and regular blood pressure monitoring. You know, we shouldn't be bashful. Nobody should be bashful getting that kind of care. You know, some of us get all bent out of shape because it says elder. You are an elder. It's nothing to be ashamed of. It's nothing to be embarrassed of. It's something that you must embrace so that you'll be okay. You know, it's a mental vacuum out there. It's stressful for you to apologize for aging and choosing instead to go to doctors that are not geriatric physicians. Geriatrics physicians are meant for your personal care. If you're an elder, they are fantastic. And one of the things I find that they themselves, many of them, not all of them, are elders themselves. So they understand what's going on with your body. And they're willing to make sure that you have a healthy, healthy experience as an elder. So for my part, I've had some really good doctors. I don't know what you've had, but I've had some really good doctors, and I've had some that I can't wait to get out of the room and I ask myself, what was that appointment about? What just happened? Because I didn't benefit anything from it. You know, so if you're experiencing that and you find that you're caught up with a physician that you think is just giving you pills, you may think again. There are some natural remedies that you can try, you know, that don't contain any hazardous ingredients that may affect you. But you know, just making sure that you're covering all bases is important. There's some natural juices that can help you. You know, many of us, when you get older, many people have challenges with blood pressure. You know, but there are other natural things that can help with blood pressure. I'm not telling you not to do what your physician says to do. Certainly you must, but at the same time, ask the physician too. Any physician who cares about you may give you a good idea, or rather will give you a good idea of what natural, um, natural resources that can help you with blood pressure and things of that nature. So be bold, ask. I mean, what's the worst thing? They say they don't know, or they don't want to be bothered sharing such information. You know, I think that an elder care uh, physician is also interested in your emotional well-being, your emotional and social well-being. So they offer support. You know, they actually arrange for social activities that encourage interaction with peers, reducing feelings of isolation and depression, which is common to older adults. Is one of the things that really cause a lot of older adults to not enjoy their adulthood, is that they're lonely. They're lonely. There's nobody there for them, particularly when the children live away from home or they're nowhere near, you know, and you don't have friends. It can be very lonesome. But a geriatric physician is interested in your social well-being, in your emotional well-being. So they actually encourage, they may even arrange for social activities that encourage interactions with peers, so that you're not by yourself, because you don't have to. I watched a video recently where an elderly lady who had been living by herself. She's a widow, and there was a younger lady who lived next door to her, and she had been watching this lady. She's lonely, and she came on out, and I told the lady, I just wanted to come and speak to you, but I can't get back home because I'm afraid to get back home. Well, if she found her way to that lady, then there's no reason for her to be afraid to go back. But she wanted that interaction. At least that's my perception. She wanted that interaction with this neighbor. So she now says to the neighbor, "Oh, I don't know how to get. I'm scared to get home." So the neighbor had to walk her home, obviously, and who knows after that. Maybe even walked into the home and kept her company. I don't know what happened after that. But as far as I could tell, she found her way to this lady's home. She certainly could have found her way back, but she needed the company. So elderly people are very, very lonesome. And just as a sidebar, if you don't have anything you're doing, sometimes take the time and go and visit a home for the elderly. Call them. There are so many nursing homes, and there's so many elderly people with no family members who visit. Family members don't visit them, or the family members are gone. One way or the other, some of them are just there isolated. And what happens when somebody's isolated, they reminisce about what was and what isn't, and that tends to speed up your life, the end of life. So it's really important that some of us take the time and go and visit a nursing home. I did so. I just got up and went to this nursing home. I called them and let them know that I wanted to come and visit, and I wanted to know, was there any lady, anyone there who had nobody visit them who could use company? And they told me yes. So I went and visited this lady. I took some pictures. I don't know where I put them, but um, she was so, initially, of course, she didn't know who I was, and she didn't know where to start the conversation. And also I started, and I started talking about my family and all of that. And so I started asking her about her family. And then she opened up. She just started talking. And before you know it, the tears were coming. She missed her family. And, the family was far away, home visit and all that sort of thing. So that's part of what a geriatric uh, physician is interested in, emotional and social support. And so they recommend social activities. So you can help in that situation, because there are some elderly people who could really use some company. That's a I encourage you to think about that as something you can do when you have nothing else to do. Say, I'm going to go and visit an elder. What I like about my new physician is that they provide resources for family members to deal with you, educating them on how to communicate effectively, and that's what happened with Margaret. The same thing, they gave Margaret support by teaching her family how to communicate with her for her cognitive needs. This is what such doctors do. And so you want to find a person who will do that and show concern for you. See, that's the thing. There's nothing more dissatisfying than feeling that you're just a number when you go to see a doctor. You're just, that's devastating, quite frankly, because you want to be seen. You want to feel that you still matter. But you do have some of these physicians that, because you're an elder, they act like you don't matter anymore. It's like, okay, well, 10 minutes is up. All right, here's the medication. Thank you. See you next time. You don't want such a doctor. You want one that's specialized to take care of people like you, people who are elders. That's what you want. As you want. And you want a physician that's going to provide you with ongoing monitoring and adjustments. I had a physician that, I just like to take care of my medical needs. So it's not necessarily that there's a big problem. It's just that I like to keep abreast of what's going on with me, you see. So you want a doctor who is going to provide ongoing monitoring and adjustments of your medications, not just one that waits till 4 months. You say, come back in 3 months. And in the in that time frame, you're experiencing all kinds of mayhem, and you're asking, you're calling, you're leaving messages, and they don't see you. Instead, they give you more medication. So, such doctors do exist. But not all of them. There are certainly very, very good doctors out there. I'm just saying, do your homework so you'll find the right kind of person for you. Don't take a doctor just because it's a doctor, or the name sounds good, or it has 5 stars on the internet. Make sure that person is good for you. Take into consideration, and that goes for, that's the same thing if you're a parent. and you want a pediatrician, make sure you investigate that pediatrician very well, because there are some pediatricians who don't have time for you and your children, your child, and it's the smile, the brief smiling, and hardly any conversation with the child, and okay, this is what we're going to do, this is what we're going to do. No, no, you want somebody who's going to talk to the child, somebody who's going to talk to mom and dad, somebody who's going to be involved. Those are the best physicians, the ones that really genuinely show concern for you and for their patient. That's who you want. Okay, so you want somebody to review regularly your progress. How you doing? I have a doctor that when I go to see them, all the nurses, God love them. As soon as you walk in there, hey, Dr. Simri, how you doing? Ooh, you're looking good today. I mean, it's almost like you just want to go there to get compliments. That's how nice they are. That's how involved they are. That's how much care they show, that they care about your well-being, not just your medication, not just your temperature, not just your blood pressure. They're interested in everything about you. And that means even making you feel welcome, complimenting you. There's nothing more wholesome to walk into a doctor's office where everybody, where everybody knows your name, where every nurse knows who you are, they know what your issues are, and they want to pump you up when you come in there. Ooh, girl, you look good today. How are you doing? Who did your hair? I love that hair. Wow, you walking real nice today. Those little things matter. You are seen. And that's the kind of physician I have right now. You are seen. When you walk in there, everybody has something positive. You don't want to be seen as a number. So do your research, read comments about that physician. I had one physician, God love her. She was supposed to be really good paying physician, and that was the worst experience. I sat there and she looked. I was having some challenges with my left knee. Thank God that's much better now. But she looked at me and I looked at her. There was hardly any conversation from her. I was doing all the talking, and then when I was done, okay, this is what we're gonna do, huh? She started her prescription. I said, nope, gotta go. Thank you. Well, I'm polite, I don't try to be rude. But if a doctor is more interested in the medication that she's gonna give me or he's gonna give me, that's not the doctor I want. I want a doctor that wants to talk about everything, including the medication. All right, but not mainly about medication that I should be taking. Okay, so you want a doctor that monitors your progress and adjusting your care plan as is needed. That's what you're looking for. Somebody works with you. You're not going to live forever. Nobody lives forever. But the time that you are here, you want to at least have a little comfort. You want to live in comfort. You want to be able to go for walks. You want to be able to go to the, play with the grandkids if you have grandkids, whatever. You want it to be, you want to be able to go out and enjoy life. But you don't want to just be cooped up and struggling because medication on is just creating havoc in your body because you have the wrong doctor. Okay. Now, all the doctors out there, don't get up. I hope nobody gets upset with me because that's not the point I'm making. The point I'm making is that if you're an elder, elders should find people who have knowledge about elder care. That's very, very important. It's important to me. I find that to be very, very important. It works very, very well. I'm not suggesting that every elder care physician is always fantastic. No, but if you're going to find one, make sure that you find one that's a good one. But they are trained for you. They're trained for the aging person. And again, they understand. That's a process we are all going to go through. It's nothing to be ashamed of. It's nothing to hate. Excuse me. It's something that, it happens. It's life. But we want our life to be positive. Okay. Now, one of the things that Margaret, for instance, her osteoarthritis, when it worsened, they integrated more intensive physical therapy and also explored pain management options, not just medication. I was at one time, when my knee was hurting me, I would just take Tylenol, but too much Tylenol is not good, you know. So this physician has recommended some of the things that will be helpful, and it's helpful. I'm the kind of person to sit around. I'm go 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 go. That's me. To go. Life is too short to be forced to just sit in a place. You have to go out there and be a part of life. And that's just me. So I enjoy having somebody who is specialized in elder care, because the support they give improves quality of life. And no, seriously, that's the outcome that you want, an improved quality of life. You want to feel secure in your home. So if there's anything in your home that's not going to be supportive of you, your elder care physician may recommend things that will make even living in your home constructive and helpful. Um, the care that you get when you feel secure in your home, and when you feel that when you continue to remain engaged socially, and your family members report feeling more confident in your care, then that's the perfect physician. You know, the tailored approach that you get from an elder care support a specialized physician, uh, the emphasis on preventative care and the holistic well-being of the person is the best thing you can look for in a physician. Somebody who is focused on your holistic well-being, not just on pills. Because as I said earlier, you must make sure that those pills that you're receiving, that their interaction is not causing more problem than it is. And you can't always blame the physician. Sometimes you have the responsibility to find out and then ask the questions, so that when you go and see your physician, you ask the question, hey, this is what I'm observing. What should I do? Is it the medication? Could it be the medication causing this? And an elder care is more adept at managing the multiple health issues, which is common in seniors. Many seniors have multiple issues. Some have liver issues, kidney issues, arthritis, you name it. So you trained to give comprehensive care. That's what you're looking for. Somebody who knows how to fix one thing and not aggravate the other. That's who you're looking for. Okay. So you need comprehensive care. The other thing you definitely need is that a specialist who is likely to consider not just your physical health, but like I said earlier, your mental and your social factors, which sometimes you're not feeling well because of all those factors. You know, your social your social well-being is important. It could be a factor that's making you sick because of your loneliness. It can impact your mental well-being. So you want somebody who's looking at everything, not just your physical health and then giving you medicine for that. And then an elder care physician also can help coordinate specialists that will make your treatment plan a little bit more cohesive, not just give you medicine, give you medicine, give you medicine, or just that one person. I've had a physician that several other physicians to see when they find that there's certain aspect of my well-being that they can handle, and they would refer me to somebody else. And the reason why all this is going on is because I'm demanding of that. You have to demand it. You want coordination of care if need be. If your physician cannot do certain things or is not aware of certain things, you want them to specialists that will help you. But you have to let them know that. You have to ask that question. Don't expect them to know. Don't expect the physician to know everything. They don't. Some of it is your responsibility. And so you must do everything within your power. And I ask you for today, from henceforth, you need to check and see the physician that you have. What do they do for you? If you're happy with them, absolutely okay. If you're not happy, then it is imperative that you begin to look at a physician that has a holistic approach to your well-being. Okay? Well, it's not strictly necessary to have a geriatric focus provider, but it can enhance the quality of care for you as an elder. The best choice, of course, on individual health needs and preferences. Okay, you may not need a physician who's only, who's an elder care. You may not need. If you're feeling just fine and you're moving along, everything about you is just going, no problems, no troubles. Hey, maybe you don't need one of those. But if you do have extra challenges, then you need to find somebody who can provide you with a holistic approach and actually seek other specialists that can ensure that your treatment is cohesive, your plan is cohesive, and that your quality of life is improved, because medications may serve a purpose to some degree, but they do mask. They're not there to cure. Medications don't cure. That's why you have to take them several times, because they wear off. Like if you have a headache and you're taking Tylenol, well, it's going to wear off, and that's why you have to take it every so often, so that before it wears off. So it's masking what's causing the pain, but not solving the problem. So you want somebody who's not going to mask your problem, but somebody who's actually going to give you what you need to ensure that you heal and that the quality of your life is excellent, both mental, both social. That's what you're looking for, a holistic physician, a specialist who is focused on the needs of the elders, if you are an elder. That is my recommendation. That is my conversation with you today. And I hope that I have shared something today that you can take with you. Again, please, this program was sponsored by the African Women Mobilization Commission. I would like to thank you for joining me today. omsiglobal.org is our website. Then the Ntomodu Show at gmail.com is how you can get in touch with this program. We also want to let you know that we are very, very much interested in interviewing individuals that would like to be featured on this show. I just want to end with this comment from one of our viewers. It says, a lot of doctors these days only care about prescribing medications. It's all about the Benjamins. That's right. That's right. That's all it is. For some of them, that's what it is. So you have to be very careful who's taking care of you. Do not get it twisted. Don't think they're all interested in your well-being when they're overwhelmed. Most of them are. Okay? Most of them are interested in your well-being. But find an elder doctor, okay? An older doctor who takes care of elderly people. And I'm not suggesting that young doctors don't take care of elderly, but those who are specialized for elderly care, that's who you want to make sure, pardon me, that you are involved in. Well, ladies and gentlemen, it's been a pleasure to have you on the show today. Thank you, Yudi. Thank you, Adora. all, for those of you who were able to make it. And I hope that those of you who will watch this later, you take uh, everything that I said to you today to heart. It's important because we're all going to get elderly someday. So preparing for it is something you must do. And making sure that there's somebody that you're going to take for the ride who's interested in you and can take care of you properly. Thank you so very much for your attention. And I hope that I see you again next Saturday. Take care.